How I've missed being on your table, Cody.
I have to go from having dinner to climbing a 30-story tower. You know, feel your muscles twitch from within is a bit of an odd feeling.
Okay, that's pain.
How long now?
The tear?
Yeah.
From the injury?
Yeah.
Probably like 3 years.
Has it been major obstacles in your daily activities?
Yeah, it's changed a lot of what I do. I had basically like a relapse where all of a sudden like I experienced like extreme knee pain and I couldn't go up and down stairs, and I had to take time off from the fire department because I was having trouble getting in and out of the fire truck, and it just was a risk. Obviously for firefighting, you can't really predict what we're gonna have to do, right? So it's been a challenge. I've had a few falls. I'm pretty clumsy too, so it doesn't really help.
All right, Sebastian. Okay, let's do an assessment first.
This treatment is going to be painful. Is any part of you scared?
I don't know if scared's the word. It's like the old saying, you know, like no pain, no gain. So you know that to recover, to move forward, it's gonna be painful. Am I looking forward to it? No.
No, so
Ooh,
that's,
right
that's
there.
where the tendon's at, huh?
Right there. A little lower. Like right there. Oh, man.
Have you ever thought about your relationship to pain?
I have, yeah, actually, just through different procedures and surgeries and stuff you have, and always wonder, like, where does my pain tolerance lie, you know, amongst other people. Sometimes I think, oh, it's pretty high. Other times I'm like, no, it's super low.
Have you ever worked to improve your pain tolerance?
Not exactly, I wouldn't say so, no. Like, there's things, I mean, that you experience throughout life, and, you know, you kind of get used to certain types of pain. Like when you're working out and exercising, like that's a specific type of pain. It's almost like a good pain. You know, but I wouldn't say anything to work on it. I mean, I've definitely broken enough bones that you could consider it me working on my pain. But
What is your pain tolerance at right now on a scale of 1 to 10?
I mean, I guess we're gonna find out, but I think I'm probably hovering at about a 7. I've had some interesting experiences with pain where my vision's gone blurry on like the really high-end painful experiences I've had, which is interesting when you have like different physical reactions.
Okay. Got a good pinch. There. Okay, stay there.
Does focusing on your breathing help?
Always. Really helps. It's probably the only thing that I find really does help, is focusing on your breathing and just trying to relax, because your whole body wants to tense up.
Why do you think people are so fascinated by pain?
I think it's because it's relatable. You know, everybody's experiencing pain, and you can always imagine what it must be like to do something.
What was your first experience dealing with intense pain?
When I was a kid, I remember breaking my hand. That was pretty painful. When you're a kid, you're not sure what you've just done. You know, as an adult, when you break something or you really hurt yourself, you can kind of quickly diagnose what it was and, you know, kind of the cause and effect. But as a kid, you're more just scared and unsure what happened.
Do you think fear still plays a factor in the pain you experience as an adult?
That's an interesting question. I think when you're expecting some pain, I think there's a little bit of fear there. Case in point, working on my knee, I start to anticipate that there might be some pain, and you kind of like a little fearful of it. For instance, right now. Oh, that's not bad.
Can you describe what you're feeling in excruciating detail?
Just more like a sensitivity, like, you know, feel your muscles twitch from within is a bit of an odd feeling, but I wouldn't call it painful.
This actually feels relaxing though.
This does, yeah. It's like almost like this involuntary relaxation.
There.
Next one will be the hip. Let's get this part sorted out first.
Can you tell us a joke?
A joke? Oh my god. I'm sorry, I can't. Okay, that's pain. It's like borderline torture, but I wanted this.
Oh, God. That was great.
Good cardio.
Yeah.
What's the training like to become a firefighter?
It kind of varies where you go, what city. They have different requirements, but there's a lot of things that are the same. You know, a lot of physical training, physical requirement, medical training, driver training, obviously fire school, learning about fire behavior, different types of construction, those kind of things. There's quite a bit involved.
What is the physical aspect like?
It's intense. Obviously our job, it goes from 0 to 60 in a split second, right? So you always have to be prepared and carry like a good level of fitness with you and cardio, because it's pretty normal for us to have to go from having dinner to climbing a 30-story tower. Yeah, it's good to keep the cardio and strength up. Once I'm all kitted out, it's about 120 pounds roughly. Depends on what you're carrying, but your fire suit's anywhere from 25 to 35 pounds. Then you have an air tank, and then your tools, your helmet, a lot of weight on the body. This is a good pain.
Have you had to perform through any injuries on the job?
Yeah, this injury that we're dealing with right now happened on the job. Fortunately, my right leg has taken quite a bit of trauma from firefighting related activities. Like I've torn my MCL on my right leg, and then now I've torn my patellar tendon. Other than that, nothing too bad, so thankfully.
What are your thoughts on ice baths?
Love. That's a good pain. It's like such a refreshing pain too. Especially as you get older, right? They start to make more sense. When I was younger, you couldn't catch me in one.
How long can you stay in the ice bath?
Depends. With breath work,
Yeah.
when you do breath work beforehand, like Wim Hof method or anything like that, I've stayed up to 21 minutes in the...
21 minutes?
Yeah, long time. But without breath work, it's a noticeable difference. So without breath work, usually like I'd say 4 to 6 minutes. Oh, this is gonna be fun, isn't it? How I've missed being on your table, Cody. Fuck.
Hey, use the Wim Hof method, that will help.
Yeah, that's right.
Favorite color?
Green.
Favorite food?
Sushi.
Oh, there you go.
There you go. Slowly.
That's a lot of progress.
Way better.
Thank you. That was a lot of pain.
I think the best advice for dealing with pain, any type of pain, really, be it physical or emotional, is like exposure therapy. If you just expose yourself to a little bit of pain every day, you're going to slowly build that tolerance. And, if it's with like stretching and kind of pushing through that pain threshold a little bit each day, you're going to push that line a little further. So I think that's how to do it.